Dr. Zoe Launcelott, and I work for the surgery service. By far the most common orthopedic disease we see is cruciate ligament disease, so similar to the ACL in humans. We also see fractures, hip dysplasia, arthritis, but by far the cruciate ligament is the number one orthopedic disease we see. Patients with cruciate disease, they typically present with a lameness, so they may be toe-touching lame, they may be non-weight-bearing lame, or they may have a very subtle lameness that's just noted when they're rising or after rest. So when the patient comes in, we'll do a complete physical exam based on the presenting complaint. If it is the knee, we will focus our exam there. We will typically put their limb through a range of motion. We will palpate the long bones, such as the shin bone or the tibia, and the long bone of the femur or thigh bone. And then we see if there's any instability or pain in that knee joint. So once we suspect a cruciate disease or injury based on instability in the knee, pain in the knee, and inflammation in the knee, we'll typically recommend radiographs that show us secondary effects based on the disease in the knee, such as osteoarthritis. We'll see inflammation or fluid within the joint, and we may actually see some translation in that knee joint. And we may actually see that the bones, the femur or the thigh bone and the tibia or the shin bone, are actually translated or in a different orientation than what they should be. There are multiple ways in order to repair cruciate ligament disease in dogs. However, the most common procedures performed here at NorthStar VETS is a procedure known as TPLO, which stands for tibial plateau leveling osteotomy. We do a lateral suture imbrication technique, as well as a TTA, which stands for tibial tuberosity advancement. Initially when we take x-rays or radiographs, we work with the radiology department. If we have any questions or concerns about the diagnosis, we may get neurology involved to make sure that it is not a neurologic issue. And then post-operatively, we work very closely with our rehabilitation department that is very much like human physical therapy, and that helps animals get back to normal activity at a quicker pace. With appropriate post-operative care, we can get about 85 to 95% of these dogs back to normal activity, running, jumping, playing.